How does trichomoniasis affect the urogenital tract? Imagine a tiny parasite causing a lot of discomfort in the most sensitive parts of the body. That's what happens with trichomoniasis, a common sexually transmitted infection caused by the protozoan parasite Trichomonas vaginalis. This parasite mainly targets the urogenital tract, which includes the reproductive organs and the urinary system, in both women and men. The way it affects each person can vary, but generally, it causes inflammation and irritation of the mucous membranes lining these areas. In women, trichomoniasis often hits the vagina and the urethra. It can lead to vaginitis, which is inflammation of the vaginal lining. Symptoms might include itching, burning, redness, and soreness around the vulva and inside the vagina. A distinctive sign is a thin, frothy, yellow-green vaginal discharge that often has a fishy smell. Women might also notice pain or discomfort during urination or sex. When a healthcare provider examines the vagina, they might see redness and irritation of the mucous membranes. Sometimes, if the infection is not treated, it can spread to cause urethritis, which is inflammation of the urethra, or even rare cases of cystitis, which is bladder inflammation. Persistent infection can last 4 months or even years if not properly treated, and it can make a person more vulnerable to other sexually transmitted infections like HIV because of the inflammation and damage to the mucosal barriers. In men, trichomoniasis often causes fewer or no symptoms at all, but it can still affect the urethra. Men might experience itching or irritation inside the penis, a burning feeling after urination or ejaculation, or a slight discharge from the urethra. Sometimes, the infection can lead to inflammation of the prostate gland, known as prostatitis, or the epididymis, called epididymitis, which are parts of the reproductive system connected to the urethra. The parasite can stay in the male urogenital tract for a long time without causing symptoms, which means men might unknowingly pass it to their partners. Overall, trichomoniasis causes inflammation and irritation of the mucous membranes in the urogenital tract, leading to symptoms like abnormal discharge, itching, burning, and pain during urination or sex. This inflammation can also make it easier for other infections to take hold, including HIV, because it disrupts the normal protective barriers. Diagnosis usually involves examining vaginal secretions, urethral swabs, or urine samples under a microscope, or using molecular tests. The good news is that antibiotics like metronidazole or tinidazole are effective in clearing the infection quickly. Understanding how trichomoniasis affects the urogenital tract is key to preventing complications. If left untreated, it can cause ongoing discomfort, reproductive health issues, and increase the risk of transmitting or acquiring other sexually transmitted infections. Using condoms consistently, getting tested regularly, and treating both partners at the same time are important steps to stop the spread. Remember, many people with trichomoniasis do not show symptoms, so regular screening is essential for maintaining good sexual health. Always consult a healthcare professional for personalized advice and treatment options.